Good morning to everyone, to Umberto, to all those who make this broadcast possible, including our sign language interpreter, and good morning to everyone tuned in to this briefing. We start today's press conference with the unfortunate news of the death of one person yesterday. The patient was a 56-year-old male who had been hospitalized and was a confirmed case contact and suffering from some comorbidities. He was admitted to hospital on August 22nd as a confirmed case contact and due to certain risk factors that he possessed. He spent 12 days in hospital, 6 in intensive care. The patient suffered from complications which progressively worsened over subsequent days, as well as an unstable clinical profile. He had to be intubated and put on a ventilator. However, yesterday he could not be revived and sadly died. We offer our condolences to the family and friends of the deceased. Today, 1,573 people are hospitalized in Cuba. 24 are under observation. There are 936 suspected cases and 616 confirmed active cases. Quite a high number. Yesterday, once again, we processed over 5,000 samples, 5,760, in our various molecular biology laboratories. 1,989 of the samples were processed at the Pedro Curi Tropical Medicine Institute, 800 in Villa Clara's Hygiene, Epidemiology and Microbiology Center, 626 in Havana's, 187 in Santiago de Cubas, 557 in the Naval Hospital, 409 in the Molecular Immunology Center, 316 in the Civil Defense Labs, 305 in the Fructuoso Rodriguez Hospital, 289 in the Manuel Fajardo Hospital Lab, and 282 in the Genetic Engineering and Biotechnology Center Lab. Of the 5,760 samples processed, 11 tested positive for COVID-19. That's 11 people. This brings the total number of samples processed in the entire country since the pandemic began to 432,040, of which 4,309 people, or 1% of all cases, have tested positive for the virus. As I always mention, samples from all of the country's provinces and the Isle of Youth Special Municipality were tested, given the level of screening taking place and epidemiological situation in certain territories. 180 from Pinar del Rio, the most, 4,362 from Havana, 147 from Mayabeque, 227 from Matanzas, 191 from Villa Clara, 274 from Ciego de Ávila, and 92 from Cienfuegos, a province which, despite reporting no new cases over recent months, continues to screen residents for the virus. As such, all 5,760 samples from across the island were processed. All of the 11 positive cases diagnosed yesterday are Cubans. All of the cases are autochthonous except for one imported case. 8 of the 11 are confirmed case contacts. This means that 3,840 people, or 89.1% of all diagnosed cases in Cuba, had contact with someone who had previously tested positive for the virus. Of the 11 cases diagnosed yesterday, the source of infection linked to 2 is yet to be determined. This means that the source of infection in 54 cases reported over the last 15 days is still being investigated. Yesterday, one person to have tested positive for the virus contracted it abroad, for a total of 415 imported cases. Of the 11 diagnosed cases yesterday, 3 are male for 50.1% of all cases, while 8 are female, representing 49.9% of all diagnosed cases. 7, or 63.6% of the 11 cases yesterday, were asymptomatic at the time of testing, representing 58.6% of all positive cases on the island since the pandemic began, and 61.4% of cases diagnosed in the last 15 days. Let me reiterate the important role played by asymptomatic cases in spreading the virus. And, as we saw yesterday, in some cases, the viral load in asymptomatic patients can be higher than in those with symptoms. This makes controlling the virus extremely difficult and very dangerous, especially if we fail to comply with the established measures with which we are all familiar. By age group, 4 positive cases diagnosed yesterday are under the age of 20. In fact, all are under the age of 18, for a total of 457 children, or pediatric cases, to have tested positive for the virus in Cuba. 388, or 84.7% of which, have responded well to treatment and been discharged from hospital. Meanwhile, 5 people diagnosed with the virus yesterday are between 20 and 39 years of age. 1 case is between 40 and 59, and 1 is over the age of 60. Of the 11 cases diagnosed yesterday, 5 belong to Havana, 4 to Ciego de Ávila, 1 to Artemisa, and 1 to Camagüey. The imported case is from Camagüey and the municipality of the same name. The other case from Artemisa is the result of local transmission and belongs to the municipality of San Cristobal. The 4 cases from Ciego de Ávila belong to the municipalities of Venezuela with 2 cases, Majagua with 1, and Morón also with 1 confirmed case. The 5 cases from Havana belong to the municipalities of Regla with 2, Arroyo Naranjo with 2, and Boyeros with 1 case. Yesterday's results therefore mean that Havana continues to have the highest confirmed case rate per 100,000 inhabitants over the last 15 days, with 22.01, lower than yesterday's figure. Artemisa follows with a rate of 13.59, also lower than yesterday. Then Matanzas with 5.83, Pinar del Rio with 1.54, Ciego de Ávila's rate rises to 7.78, Las Tunas has a rate of 0.93, Villa Clara with 0.51, Mayabeque with 0.26, and Camagüey with 0.13. This means that, compared with yesterday's rate, Cuba's drops to 5.68 per 100,000 inhabitants over the last 15 days. To summarize, of the 4,309 people who have been diagnosed with the virus thus far in Cuba, 616, or 14.3%, are active hospitalized cases. 600, or 97.4%, are clinically stable. Yesterday, unfortunately, one COVID-19 related death occurred in the country. This means that the COVID-19 death toll on the island stands at 101, with a mortality rate of 2.34%, lower than the global rate of 3.28% and the regional rate, which stands at 3.45%. As I always mention, 2 people were evacuated at the start of the pandemic. Yesterday, 20 people were discharged from hospital, a positive result in regards to the discharge confirmed case ratio. 12 people were discharged in Havana, 3 in Matanzas, 2 in Villa Clara, and 1 each in Artemisa, Mayabeque, and Camagüey. This means that to date, 3,590 people, or 83.4% of all confirmed cases in Cuba, have recovered from the virus. Today, 3 patients continue to be in a critical state, and 13 reported as serious. Yesterday, 5 patients reported as serious passed to closely monitored. This is the situation in Cuba. I'll be honest that today's results regarding the number of confirmed cases seem positive. However, the risk of the spread of infection is still very high everywhere across the country, but especially in areas where clusters of cases have been reported over the last 15 days. Now, we are going to turn our attention to the world. As of yesterday, COVID-19 continues to be present in the same 185 countries. Yesterday, 304,562 people were diagnosed with the virus, for a total of 26,640,247 confirmed cases since the start of the pandemic. Yesterday, 5,754 people died of the virus, for a mortality rate of 3.28%. The region of the Americas, which accounts for 52.66% of all cases worldwide, reported 146,322 new cases yesterday, for a total of 14,031,248 people to have been diagnosed with the virus. 3,505 people died of the virus in the region yesterday, for a death toll of 484,673, and a mortality rate of 3.45%. Now, if Leonardo could help us by bringing up the map of the world, showing the worst affected countries, we can see that the United States continues to top the list with 6,201,726 confirmed cases and 187,765 COVID-19 fatalities. Notice how the worst affected countries are highlighted in dark red. Brazil follows with 4,092,832 cases and 125,521 deaths. Then India with 4,023,179 confirmed cases, and 69,561 COVID-19 fatalities. Russia is in fourth place with 1,015,105 cases and 17,649 deaths. This is the information we have on the behavior of the pandemic in Cuba and the world.